Danielle. I'm the clinical practice lead on the surgical floor at Colchester East Hants.
And I'm Christina. I'm the health services manager on the medical surgical unit at Colchester.
So hi Danielle and Christine. We're at the Safer F conference today, and you've been talking about the importance of mobility, and you talked about a brilliant example of a patient. Do you want to talk us through about what you did and what the benefits were for that person and also for you as a team?
Sure. With recent natural disasters that's happened in our province, we had some patients repatriated to our unit. One of those patients, what we were told in report, is they were hospitalized for 9 months, immobile, going to long-term care, and we were just a housing place for them temporarily.
So, like she said, when this patient came to us, she was immobile and bedridden. So when she got to us, we have a rehab team at our hospital, so we got the teams involved, and we started chatting with the patient about going to long-term care. And during these conversations, she was able to tell us that she actually had a home and that she would rather go home than go to a long-term care facility. So with that information in mind, we started rehabbing her, mobilizing her daily, and all the teams involved and everybody did great with her. She was involved in her care and her discharge goals. By the time she was ready to be repatriated back to her home hospital, she was mobile. So when we sent her back, she was getting up out of bed. She had a mobility goal and plan that we sent with her, and no longer needing long-term care, and eventually would go home. She still had a bit of a journey ahead of her, but she was motivated, the team was motivated to get her going, and with that plan, our hope was that she did end up going home.
So this is something you really believe in, mobility.
Yeah.
Give us a top tip.
Basically, listen to the patient and help support what they want.
Getting them up multiple times a day.
Our number one goal in our unit is mobility. We often joke with staff to try to get them moving is we'd rather have somebody mobilized than fast.
Yeah.
So we're trying to change that culture on our unit, that mobilization is the top priority of patients rather than all of the other stuff.
Brilliant, you're doing a great job. Keep up the good work.